Hey everyone, my name is Dr. Michael Wald, and welcome to this podcast, which I've called the Cortisol Lie. And the reason I've called it that is because everything you've heard about cortisol seems to suggest that it is all negative and it has no good or beneficial effects in the body. So we're going to explore this area right now. I'm a doctor of chiropractic with a board certification in nutrition. I also have a master's degree in nutrition, and I'm a sports nutritionist. I have a medical diploma, but I do not have an active license to practice medicine. I'm a life coach and also provide acupuncture to my clients. I've been practicing for just about 33 years right now, so I thought I would share with you some of my insights into cortisol. So to begin with, this information is for your education. It's not meant as a substitute for sound medical or health advice. And this is the basic chart that explains what most people know about cortisol, and not a whole lot more than this. And that's basically that cortisol, which is produced by the adrenal glands, which are two glands that are about the size of your thumbs on the top of your kidneys, okay, in the back here. So basically, cortisol, as this little diagram shows, promotes fat storage, and that is true. At a certain level, in some people, cortisol, if remains excessive over time, serves as a sort of a biochemical language telling fat cells to get larger. So that is true. But you need to understand a little bit more, I think, about cortisol and its role in the stress response. So the stress response is a term that was coined by Hans Selye, who is considered the father of stress. He was the one who first coined the term stress to the body. Stress before Hans Selye was just a term that was used in engineering. So he applied it to the body, and he basically said that there are three different reactions to stress that make up what we call the stress response, and that's it right here. We initially go through what's called an alarm reaction, and the cortisol levels go up, and that alarm reaction is usually associated with, by definition, increased heart rate, increased pulse rate, sweating, increased reaction time, that sort of thing, because it's meant to tell the body that there may be a danger around. And that response may go on for a while, and let's say it does, and that the body goes through a stage of resistance, and resistance should be relatively short-lived. And if it's not, and the body stays in this alarm and stage of resistance too long, then the exhaustion phase happens, where cortisol levels and other hormones take a dive. And that's when a lot of the degenerative stuff happens. So let me read you a little bit about this. So this stress response, this cycle, is part of the body's adaptive response. So it's a normal thing for survival, ensuring that energy reserves, fat, are metabolized and stored for survival in times of crisis. So if the body experiences stress, it may hold on to fat because it thinks that it needs to run away, and it might need that fat later for calories, for energy, for survival. By increasing cortisol, in response to fat and inflammation, the body temporarily controls immune hyperactivity and maintains balance under stress. So during the stress response, the cortisol is actually needed to help manage the immune response. But anything like this that stays around too long may have what's called a reverse effect, where cortisol at the beginning has a positive effect of survivability and maintaining immunity and putting on fat for future caloric need. But then when it's too persistent, then the cortisol levels start to reduce the immune system, promote too much inflammation, and then eventually the cortisol level may go down, which reduces resistance in the body. So these are reverse effects. The feedback loop of alarm reaction, stage of resistance, and stage of exhaustion, okay, this loop is healthy in the short term, but problemsome, or its issues in the body, as I mentioned, arise when it becomes too chronic. And like so many people today, we're under stress, and this alarm reaction stays around for hours and days and months, and for some people even years, and they wonder where their diseases come from. If you're a very highly stressed person, what they call a type A personality, you'll tend to have high cortisol, which damages the cardiovascular system, which is why type A people tend to get more heart attacks. But they're so resilient that they tend to also survive more of them. But other people that are type A's will tend to get intestinal inflammation and erosions like esophagitis and gastritis and ulcers from chronic stress. I have a young woman right now, a client who, she does have all of these gastrointestinal signs of stress. And when I asked her, what does she feel every day as she goes about her life? And she says that she's afraid of everything. That's someone who that brain is going to tell the adrenal alarm reaction to kick in. Cortisol is going to cause adverse reactions, and we get a whole cycle of degeneration in the body if this stress response is too persistent. So cortisol, you should know a little bit about it. Number one, it's a glucocorticoid hormone. It's produced by the adrenal glands, as I mentioned, in response to stress, and it's needed to regulate metabolism, immunity, and the circadian rhythms in the body. Chronically high cortisol can promote weight gain, particularly around the center of the body, what they call central adiposity or abdominal fat accumulation. And that's in part accomplished because of changes in blood sugar and fat metabolism being slowed. And cortisol supports survival because it mobilizes glucose and fatty acids during stress and the immune system's energy needs. It even helps to control an overreactive immune system until the stress response is too long and cortisol levels are too high. So here's a picture of the adrenal glands. I know it looks a little bit like the kidneys, but the adrenal glands is the part on top, okay? And cortisol, along with other stress hormones like DHEA, are made by the adrenals. Aldosterone is another one, all made by the adrenal glands. And as I mentioned, the adrenals have a role in the stress response in the body, whether or not that stress is psychological, meaning perceived and not actual, or it's actual. Also metabolism, general metabolism of the body, the ability to burn calories, immune balance, energy production, inflammation control, blood pressure, cardiovascular health. All of these are dependent, or I should say, are influenced by the adrenal glands and the stress response. Now, excess cortisol over time, too much of this stuff, contributes to chronic inflammation. It can damage tissues. It can accelerate disease. Optimal cortisol levels support healthy sleep-wake cycles and daily energy rhythm. So how do you know whether or not your cortisol is too much or too little? Well, you can test it, and we'll discuss the ways of testing it in a minute. Cortisol imbalances are negatively influence, I should say, longevity by accelerating cellular aging and, very importantly, what's called telomere shortening. So if we have a chromosome, chromosomes have a tail on it, and as we age, the tail gets shorter and shorter, so telomeres shorten. And certain nutrients like DHEA, zinc, for example, various phytonutrients, they can increase the telomere length and also slow down the shortening, and those are the sorts of nutrition that people need. And finally, for now, proper cortisol regulation helps maintain cardiovascular tone and blood pressure. But again, if it's too excessive, it has all the opposite or reverse effects. So is cortisol good or bad? Well, that depends on its level, and it depends on the total situation of the individual. High cortisol increases cardiovascular risk by promoting high blood pressure, insulin resistance, and arterial plaque formation. Problems that most people exclusively focus on their diets for, but it could be stress. Chronic excess cortisol raises the risk of type 2 diabetes, that's non-insulin dependent diabetes, and also metabolic syndrome, which is high blood sugar, high blood pressure, and high blood fats that occur all together. That's metabolic syndrome, very common. And then there's low cortisol. I put here adrenal insufficiency because endocrinologists in medicine, when they diagnose a truly low cortisol, that's usually in the context of other low adrenal hormones, and they call that adrenal insufficiency. I mention this to you because regular medical endocrinologists and doctors, they don't recognize that you can have a weak adrenal system unless the cortisol is clinically low. But your cortisol could be on the low end of normal. And for us natural healthcare providers, we consider that adrenal insufficiency, and we want to treat it. We don't want to let adrenal failure happen. And low cortisol, again, or adrenal insufficiency, impairs the ability to handle stress and destabilizes one's metabolism. Cortisol also is a stimulant to the immune system, but too much for too long can create immune imbalances and even contribute to tissue degeneration and autoimmune flare-ups and immune suppression. So it can actually cause hyperimmunity, that's the autoimmune part, by affecting what's known as the humoral immune system. And it can also cause immune suppression. And when we use that term, we usually mean that the various types of white blood cells, like the lymphocytes and the neutrophils and others, are deficient, one or more of them. Usually with autoimmune and cortisol issues, we might actually see both autoimmunity and hyperimmunity sort of on one side like this. Okay. So in the brain, it's important to know that cortisol affects memory, mood, and cognition, with chronic excess linked to depression and cognitive decline. There are so many people that have these health problems I'm mentioning that they're just thrown medications at them, or even nutrients, when they need to work on their ability to manage stress, their coping mechanisms, working on cognitive distortions, things like emotional reasoning, where some people feel that just because they feel deeply emotionally that they're correct about something. And this can lead to maladaptive changes in the stress response and the exhaustion phase, and all of these adverse health effects. Cortisol also influences bone metabolism, and long-term elevations of cortisol can lead to bone softening or osteoporosis. Proper cortisol balance maintains resiliency to infections and recovery from illness until the cortisol levels are either depleted or they have been high too long and the body starts to maladapt. Managing cortisol through lifestyle, stress reduction, clinical monitoring can reduce chronic disease risk and improve health span. Now, in terms of testing, these are just some of the more common tests that we might think about to properly evaluate cortisol and the whole stress response. A 4-point salivary cortisol test, which is really good for assessing daily cortisol rhythms and stress patterns. Serum cortisol monitoring in the serum, which measures baseline adrenal function, and what's known as the hypothalamic pituitary axis, or HPA. So we have the cortisol producing the adrenals talk to the thyroid talks to the anteropituitary. This is known as the hypothalamic adrenal pituitary axis. And then there's what's known as a Dutch complete test. It's a urine test which measures various cortisol and cortisone metabolites. Then there's a ACTH test, adrenal corticotrophic hormone test. It's basically a test of the functionality of the anterior pituitary gland related to its ability to stimulate the adrenals to release cortisol. And then there's a 24-hour urinary free cortisol, and there are single random salivary urine tests. You don't need all of these. You may not even need any of them. Sometimes I can just make an assumption that some of these are going to be abnormal, and if I'm treating you naturally, I'm certainly not going to hurt you. But sometimes we need to resort to the testing, and when we result with the testing, that will tell us something about where your stress response is at, where your cortisol levels are. We'd also want to measure some inflammatory mediators, some nutritional levels, figure out a food plan that is good for you to manage your stress response, along with psychological life coaching help there. It's really important to do that, to work through these errors in thinking and working on coping mechanisms. And then nutrition just has more of a role. And then when you figure out the nutritional supplementation, the supplement doses always need to be orthomolecular. That is a term that means the doses are optimal. They may be high levels of supplements, but they would be optimal for that particular person. And then you may be on various medications that might indirectly or directly affect cortisol levels, like steroids, for example, like prednisone. That's notorious for reducing cortisol levels and other adrenal hormone levels, causing atrophy and shrinkage of the adrenal glands and having a whole bunch of other adverse effects. So medications that you're on matters, the way in which you manage your psychological health, your foods, your supplementation, all of that is there whenever you want to consider a cortisol. So I hope you can see from this presentation that cortisol has its role. And sometimes if we can guess or think that the cortisol level is going to be abnormal, we don't need to do expensive testing. We just need to do the right natural things. So I hope this was useful to you, and I will see you at the next podcast. Thank you.